Hello friends, I'm Dr. Nikita Deshmukh. Today I just wanted to share a few important things. I'm an ENT surgeon, a head and neck surgeon, pediatric ENT, and I also deal with vertigo patients, so basically neurotology. Now what is interesting thing that I want to discuss today is about the oral cavity. So we all are aware that the oral cavity is mainly compromised of our tongue, cheek, teeth, tonsils, and the salivary glands. So now it's very important to understand that the oral cavity has the main contribution from the teeth. We have 32 teeth, right? And the teeth are an important part of our body. When you chew your food properly, digestion takes place extremely well, because whenever chewing of the food is proper, then saliva is going to be secreted in the adequate amount, and saliva is basically alkaline in nature, so it digests the food properly with the help of the salivary amylase, that is a particular digestive protein. So 80% of your work will be done, digestion work will be done in your mouth if you're going to chew your food properly. Now it's not just digestion, but also there is one more good news that I want to share with you. If you chew your food properly, then you will not have wax built up. So wax formation and removing hard wax is quite an irritating procedure, and it's pretty painful as well. So if you have the habit to chew your food nicely, you use both your sides properly, you're not going to have any wax formation. Another important thing I want to share is that the dental hygiene is often related to the ear, nose and throat. Now you might ask, how is it so? So the upper teeth basically are connected to your sinus, maxillary sinus, especially the floor of the maxillary sinus. So if there's any infection in the upper cavity, that can communicate with the maxillary sinus, and that gives rise to severe sinusitis. Also, there is the inferior alveolar nerve which travels through the jaw, and it supplies the ear as well. So neuralgic pain in this area is very common. So referred pain is one of the things which you have to keep in mind. Like, ear pain is not necessarily ear pain, it can be because of the temporomandibular joint, which is the chewing joint. That's basically a ball and socket joint. Or it can also be because of an impacted wisdom tooth. That also can irritate the inferior alveolar nerve. So how will you identify? So see, these things are not going to happen with the help of ChatGPT. There's no point in just putting cameras in your ear and trying to figure out what is happening. See, there are specialists who are there, and especially like ear, nose, throat, dental surgeons, all these are such specialized branch where it involves more of an action. So basically I would recommend, do not go for any kind of self-cleaning. Don't try to examine your ear with the help of kind of high-tech cameras and kind of machineries which are available. It's a strict no-no from my side, because I see so many times that patients come with earbuds stuck into the ear canal, or sometimes they are so harsh that they scrape the ear canal skin, you land up with your perforations. So it's not at all recommended handling your ear. Just leave it alone, and the body has the tendency to clear its own tissue by its own mechanism. So you chew your food properly and you're sorted. 32 times mindfully, eat mindfully. That will improve your digestion, it will help reduce your weight. So many good things will happen, right? And another important thing I want you to understand is that oral cavity, the tongue is a very mobile and vascular structure. So if your tongue is getting caught up when you are eating, like if you're getting cheek bites, you're getting tongue bites, please don't ignore this problem. Go and see your ENT. If there is any kind of a area which is, you are getting recurrent ulcers and things like that, please, these things can be very dangerous. I've seen so many patients who have traumatic ulcers in the oral cavity, and they've ended up with malignancies at very young age. So all these things are extremely preventable. So what I recommend is, every 6 months go and see your ear, nose, throat specialist, and also go for your dental checkup. So at least you know what's happening in your oral cavity. And oral cavity is a gateway to the entire body. Basically, the oral hygiene reflects your body hygiene. So if you have reflux problem also, it's going to reflect in the oral cavity, in the tongue, in the throat. If you have a sinus problem, again it reflects into the oral cavity in form of postnasal drip. Now the ear, nose, throat are all connected to each other. There is a tube that connects the nose and the ear. That's the eustachian tube. From there, nose infections can travel into the middle ear. From the middle ear, they can go into the mastoid bone, they can go into the jugular vein, that is in the neck, or they can go even worse, into the brain. So please don't take your oral health and your ear, nose, throat health lightly. It is very important that you are vigilant. Do not wait for symptoms to arise like pain. Please get your routine checkups done, and please do not self-medicate. That's the reason why I thought I should come live and let you guys know. You can reach me out if you have any questions on this particular page, because before I start my day today I've gone live. If you have any questions, I would be happy to answer them. Thank you.